Hello, friends. My name is Marty Sytsema. I am one of the instructors with Great Lakes Seminars for the clinical approach to myofascial release. So I'm going to be talking you through how to do a fascial fulcrum release. In our class, we talk about how to do superficial releases and intermuscular releases, and these fascial fulcrums are unique because it's essentially a superficial release from the top and the bottom at the same time. So this works really well on any of the larger joints. So what I'm doing is I'll have one hand, and we'll just do the shoulder first, but I'll have one hand at the anterior shoulder, one hand at the posterior shoulder. And what I'm essentially doing is I'm putting a compression into that, a very light compression. But then what I'm going to do is just assess which way that fascia doesn't want to move. So I'm going to compress, and then I'm going to say, what's tighter, here or here in that plane? Whichever one's tighter, I'll hold it there, and then I'll check another plane. Which is tighter, here or here? Whichever of those is tighter, I'll hold it. Then I'll add a third plane, rotating, rotating. And then we wait. So at the shoulder, I like to cup that whole humeral head just in my palm. So what I'm going to do first is just compress into it, and it's pretty much a mild compression here. Compressing, and then I'm going to go medial lateral. What's tighter, 1 or 2? That one is right there. Then we're going to go up and down. What's tighter, 1 or 2? 1 is. So now I'm holding the first position and the second position, and I'm adding a third rotation. And I'm having flashbacks of going to get my eyes checked as I do this, because essentially that's what you're doing. What's tighter, 1 or 2? Then they go click, click, and they change something on their little funny glasses things, and then ask you another one. So the time that I will use this is if I've done a lot of other things at the shoulder and they're still having just 10% of the problem. This is a really nice one to finish up with, to just clear up all the loose ends. The other time I'll use this is if the patient is just very painful, where they're not tolerating much of anything. This is just a very gentle technique that is a nice starting point in those cases. So just like the other superficial releases, I'm just waiting for a release to occur. And the release is just sort of my hands just melting down into the tissue, and I just follow that release. Now, I'm showing this on the shoulder, but this works really well on any of the other large joints as well. So I could do that at the elbow, either anterior posterior or more medial lateral like this. Same thing, winding it up. I could do it at the knee, compressing into it. What's tighter, up or down, anterior posterior, rotation, rotation. I've even done it before with like a whole bunch of ribs. Thank you. Where you just compress into the ribs and say, what's tighter, going medial lateral, up or down, rotation, rotation. So once again, this is a really good one for after you've done a lot of micromanaging in the area, just to get the final bits together. Or, and I use this more often, is if they're just too painful to really do anything else, this is just a very nice first technique to get us started.